Aishling. I'm a speech and language therapist working for Fife Health and Social Care Partnership. I mainly work in the community, so that involves seeing outpatients, day hospital patients. I'll go out to care homes and see people in their own homes if they can't come into the hospital. And I work on and see some patients on the wards here at the community hospital. So my role involves working to support people, adults who are experiencing communication and swallowing difficulties. So communication difficulties can involve voice, speech and language, and swallowing difficulties involve changes with eating and drinking. As a speech and language therapist, we want to support the person to feel that they are coping well with their condition, so that they're feeling more confident and feeling in control of their condition. So this involves looking at what's important to them in their day-to-day lives. So in relation to communication, this could be that they are finding it difficult to have conversations over the phone or meet up with their friends and family. So we would look at strategies and ways to support them to feel more confident to do this. If it was about their swallowing, we would carry out an assessment. So again, we would look at see them have something to eat, something to drink, and see where the difficulty lies. We would then provide advice. So for example, this could be something simple as helping them become aware about how they can prepare their meals so that they're easier to eat. So this could be chopping food up into smaller pieces. It could be eating or cooking their food in maybe a soft cooker so that the meat is nice and tender, maybe mashing it down or adding a sauce so that it's a lot easier for them to swallow. It could be as well about finding out what they're doing day to day. Is it stopping them going out to a restaurant? Are they nervous about what foods they should pick? So it's just by going through safer foods and things that they can eat like that. So for example, we might see somebody with Parkinson's initially, if they feel they might benefit from therapy to target increasing their volume or with the rate of their speech. And this could be individually or in a group session. After intervention, they would be able to use those strategies to support their own management. But then we maybe see them at a later stage when they're struggling with maybe difficulty swallowing, and they would then be encouraged to re-access the service and supported to do so at that time when it was felt it was required. In Parkinson's disease, people could present with a speech difficulty. So this could be quite varied. Somebody may have a difficulty with mumbled speech. They may have a fast rate of speech or quiet speech. Some people may find that there is a reduced pitch or intonation changes, so their speech may sound more monotone in conversation. Other people may exhibit reduced facial expression, so this can affect how somebody would interpret their meaning, so that can be have quite a big impact for someone. Other people may struggle with initiation of conversation or with quick changes in conversation. So we would support them depending on what difficulty they have. What I would find is the most common difficulty with people with Parkinson's disease is a reduced volume in their speech. So, but they also tend to have a difficulty recognizing this. So for example, they may find that their friends and family are telling them that their speech is quieter, but they themselves feel that they're using their normal voice. There tends to be a disconnect between the volume they think they're speaking at and the volume they are producing. So so some things that help people are just being aware that their volume has reduced, and they are then able to increase this volume by themselves. Other people find that an attention to effort approach is useful. So this is looking at what specific difficulty they're struggling with, then working on increasing their volume and providing feedback for them. So we can have a decibel meter that provides visual feedback for them. It tends to be using drill practice as well. So we would work on producing loud sounds, producing louder sentences, and then into general conversation, and again giving them that feedback, so recalibrating that sense of effort that they need. Your speech and language therapist would also give you specific advice about what will be useful for you. So it may be that somebody needs advice on overemphasizing particular sounds or slowing down their rate of speech. So we would work directly with somebody on supporting their intonation. So there are different apps that you can get as well that will show the person the various pitch changes that they're using. So again, working on that in general sentences and conversation, and encouraging them to emphasize certain sounds or certain words. So that can be really useful for them. And again, friends and family can be really useful in this situation as well, to provide advice and give them feedback on that. Looking in a mirror again can be really useful as well, because it gives that visual feedback about facial expressions and changes in conversation. Somebody with Parkinson's may present with a swallowing difficulty. This tends to be as a result of a change in the muscles of their face and throat. So they may initially present with a difficulty with maybe harder or chewy foods like meat, or dry crumbly foods like a biscuit or toast. So we would then advise them, we would carry out a swallow assessment. This would look like just observing them having something to eat and drink, and identify where any difficulties lie. So we could support them with strategies or advice on reducing that impact for them and making eating and drinking easier for them. Other people with Parkinson's disease may find that they have difficulty with excess saliva. So this tends to be a result of swallowing less often or reduced sensitivity to saliva in their mouth rather than an overproduction. So someone may find that when they are concentrating that they may drool on one side, maybe when they're reading the paper or watching television. So we would often advise them to maybe have a drink of water by their side, a bottle of water, so that they can just sip this quite regularly, because that will encourage increase the rate of swallowing. Also, it can be useful if somebody chews some gum or sucks a sugar-free sweet, because again that will increase the rate of swallowing and encourages mouth closure, as long as it's safe for someone to suck a sweet like that. Other times people may benefit from a swallow reminder badge, or an app on their phone that can beep to remind them to swallow. If they're still struggling with excess saliva, then medical support can be useful. So your GP or the specialist nurse could recommend medication that could thin down the secretions if they're quite sticky, or dry up the secretions. People with Parkinson's disease will often be able to self-manage their volume, because they'll be aware of how to use their louder voice every day and practice that sense of effort required, and they can get feedback from their family and friends about their pitch or clarity or pace of speech. They can also use apps on their phone for that volume feedback. Apps on your smartphone are really good. They can give that verbal feedback that will say general conversation, or it might say background noise, so then you will know that you need to increase that volume. Also, again, using a mirror for that visual feedback. People with Parkinson's disease are often able to self-manage their any swallowing difficulty as well, because they will be aware about what food is catching in their throat or sticking there. So for example, if they're finding that a biscuit is sticking in their throat, they may be able to self-manage that by modifying it in some way, like dunking it in their tea, or if meat is an issue, for example, they may be able to modify that by cooking in a slow cooker or mashing it down, making it nice and soft and moist. There are times that we would recommend that people do contact the department, however, if they are choking on food, for example, or if they're getting chest infections, then that can be an indication they need to contact their GP. The thing that I find most useful in my practice is that people with Parkinson's disease and their friends and carers tend to get most benefit from meeting other people with Parkinson's disease. So whether that's in a group run by the speech therapy department or an event run by Parkinson's UK, so I think it's really useful to go on the website and find out what your local branch are organising. We will often go into care homes and see patients there, but we will also work on supporting the staff around understanding about how to support management of Parkinson's disease, but also more generalised for other conditions that people would work with in care homes. So it's about speaking to the person as an individual, making them feel comfortable, giving them choices and supporting their language. And with around eating and drinking, we can provide specific advice for people. So there are specific difficulties that people with Parkinson's disease will have. So for example, with stiffness and tremor, it can be difficult for people to physically bring the food from the plate to their mouths. So recommending changes in utensils. They might find it easier to use a spoon rather than a knife and fork. They may need their food chopped up so that it's easier to stay on the spoon, avoiding it being dry. And things like that. But in general, in care homes, it's about supporting the management of the care staff, and they feel happy to be able to contact us, and also supporting their family as well, because although they're in a care home, it does tend to be their family who see them see them quite often, and who can use our help and support.